General Boris Lushniak. I'm the Acting Surgeon General of the United States.
Wonderful. Well, thank you for being here at our annual meeting. Can you tell us what you hope to get from this year's meeting?
Well, this is one of my favorite meetings of the year. I think, part of the issue of or the benefit of coming to this meeting is the ability to interconnect. I'm part of the U.S. Public Health Service. We're a relatively small service, but it's the ability for us to not only get to know better our friends and colleagues in our sister services, the Army, the Navy, the Air Force, the Coast Guard, the Marines, but at the same time to be able to interconnect with some of our international friends and colleagues. I just spent a few minutes here with the Surgeon General of Canada, an old friend. Why is he an old friend? Because I met him at this meeting. At the same time, it's the ability for us to share science. It's the ability to share new concepts. So this meeting, from my perspective, is the social side of the house, but also the medical, the healthcare information side of the house. There's always great presentations here, and this is one of my favorite meetings of the year.
Wonderful. And you just gave a presentation about smoking cessation. Can you tell us anything about that if we weren't there?
Well, this is a big year for us. So this is the 50th anniversary of the first ever Surgeon General's report on smoking. So Surgeon General Luther Terry, who used to wear a public health service uniform 50 years ago, was the first government entity to come out and say a simple word. And the words were, smoking is bad for you. And today we are commemorating the 50th anniversary. We were instilling in people the passion of saying that even though smoking rates have come down a whole lot in these 50 years, that our social norms regarding smoking have changed a whole lot in these 50 years, we still have a battle in front of us. Right now we're down to about 18% of the U.S. population who are smokers, but that still has an incredible toll on our nation. 480,000 people each and every year are dying from smoking-related diseases. 5.6 million kids under the age of 18 who are now alive will die prematurely from smoking-related diseases if I allow this current trend to continue. So we're really kind of angrily saying enough is enough. We're really pointing out towards creating a smoke-free generation in the generation. We need to zero out the use of tobacco products.
Wonderful. Are there any plenaries or sessions that you can highlight any more than others that you would recommend to people here this week?
Well, one I'm really excited about is the plenary session. There's a few here on the Ebola crisis. That certainly is late-breaking news in terms of something that we wouldn't have had at last year's meeting. It just shows you the beauty of the healthcare profession, the beauty of medicine, in that in the midst of a crisis, what you're reminded of is you become humble. You realize that these pathogens are out there. The session in particular that I'm looking forward to is one that my deputy, Rear Admiral Scott Giberson, is going to be leading. Scott just returned from a 6-week deployment as the commander of the U.S. Public Health Service response to Ebola in Liberia. We're the only U.S. government entity there on the ground actually touching patients. And so I'm proud of my team that's out there right now. We'll be able to share some of the information of what the team did in terms of training for this mission, in terms of preparing for themselves, and then current activities that the team is undergoing in terms of treating healthcare workers in Liberia who have come down with the Ebola virus disease.
All right, and one thing to wrap it up, if there's anyone here who is not yet a member of AMSUS, can you recommend something for them to maybe join AMSUS?
Oh, without a doubt. I think AMSUS, I'm a lifetime member now of AMSUS. It's an incredible organization, and again, it brings you that connectivity with federal practitioners, with federal healthcare workers throughout the United States, but also the internationalism that exists out there. There are so many of us who serve in uniform or in civilian clothes in our healthcare system, and the ability for us to interact, to be able to get together as part of an organization like this, it's worth the cost of admission.
Wonderful. Well, thank you so much for your time, Rear Admiral Lushniak. We appreciate it.
Great, it's my pleasure.